So my journey began last March. I developed abdominal pain, and my husband and I were planning to go south. And he said to me, "You're going to have to go and have that pain checked in case something happens when we go south." So I went to the Emerge department at Kings County Memorial Hospital. The doctor on call, Dr. McGinnis, thought that it could be my gallbladder. He said, "If it continues tomorrow morning," he said, "call me and I'll call the radiologist on call at the QEH and arrange an urgent ultrasounds." So I went to the radiology department, and the tech, who now I can say probably saved my life, she said, "I'm just going to keep fishing around." Nothing was showing up in my gallbladder, and she kind of found something suspicious in my lower abdomen. There was a mass in behind my uterus, and they couldn't really identify either of my ovaries, and she was concerned that it might be a tumor or a malignancy. So she ordered some blood work that could show if it was maybe positive for ovarian cancer. I never kind of thought that that would be one thing that I would be diagnosed with. And being a nurse for all these years, I was at the bedside, and I was there when doctors would tell patients they had cancer. And to be diagnosed yourself, it's kind of surreal. I almost felt like I was standing on a mat and someone pulled the mat out from underneath me. The staff are just excellent. Like, they just make you feel so relaxed, even though you're anxious because you're wondering what are they going to find in this CAT scan that they're doing. But you know, they offer you the warm blankets. There's volunteers around that offer you drinks, like, you know, sooner finish a little snack and they're coming through and giving you another snack. So like, the treatment and the care is just above and beyond.
Poole thinks that her care was enhanced by new technology being used at the QEH.
As a nurse, I know that there are some people that are really difficult to get an IV on, and I happen to be one of those people at the Cancer Treatment Center with my 6 chemotherapy treatments.
Really helpful for people with small vessels, and even people that have good vessels that have anxiety about placement. We can look and determine if a vessel has good perfusion, or where there's bifurcations or valves, so that we choose the best optimal place to insert the IV in a patient. So often these patients would have to endure multiple attempts at IV insertion. This actually makes our job so much easier. We can actually visualize veins that we might not be able to palpate.
And I am so happy that I was able to have my treatment closer to home. I was closer to my family. My chemo, it took almost, like, I was there probably 6 to 7 hours by the time the girls would get my IV, and then to have the 2 drugs. So it was like a full day. So I was so happy. I only had to drive an hour to get home to my own home after the chemotherapy, and it just was excellent to have it right at the QEH close to my home.